delivered because you all came back. As Carrie mentioned, my name is Laura Marquez. I am a program supervisor for Help Me Grow El Paso here at PdN Children. This is now the fourth installment, I believe, of this Texas tour that we've done with TexProtects. And, we're just really grateful for the continued investment in our community. What TexProtects does at the policy level and a statewide level influences the work that we're doing at the community level. And so all the initiatives and everything that we're doing ultimately is to make sure that children grow up in a safe and healthy environment. And that starts with supporting parents, supporting communities. And so I'm just really excited to get started with this conversation. And without further ado, I'll pass it on to Jordan.
Thanks so much, Laura, and welcome everyone. Thank you for coming, and thank you to Paso del Norte for continuing to be such a fantastic partner. We're excited to be back and kicking off our Texas tour again, and we're really glad that you all could join us today to discuss and kind of further the discussion on our legislative priorities. We're excited to hear from you all and your continued feedback. This time last year, we got a lot of info and insight from you all about what was going on in your community and what you all felt were the most pressing issues for us to consider. And so we want to thank you for joining us today in kind of a part two, so that we can present to you all kind of what we're planning to promote and push at the legislature, and hear your feedback on those priorities. It's important to us that today is interactive. We're going to lay out what we are planning to push and what we see as the priorities and kind of current state in the child protection and well-being landscape. But we want to use the majority of the time today to hear from you all. And so today we want to learn what folks in your area are doing and working on that aligns with our priorities, and definitely provide a space for you all to give us updates and figure out how we can join forces to make sure that these priorities are successful in the upcoming session. So lastly, I want to thank our sponsor, the Texas Child Welfare Funders, and to introduce Adrian Cook, who's today's representative from the Texas Child Welfare Funders. Adrian's the Director of Research and Evaluations at the Reese Jones Foundation, which is a global grant-making organization in North Texas. Adrian heads up topical analysis into the areas of giving of the foundation, which include child welfare, youth development, mental health, and global issues. He also guides evaluation for the foundation's grant making and is the treasurer for the Texas Child Welfare Funders. He participates in the ministries of Highland Park Presbyterian Church and resides in Dallas. And so without further ado, Adrian.
Jordan, thank you for that nice introduction. And thank you to TexProtects for offering this Texas tour to the nonprofit service providers, funders, and others who care deeply about and work to improve child welfare in our state. The presentation that TexProtects has for us today, a preview of the upcoming legislative session, and dialogue around priorities for youth and care are exactly the issues important to the Texas Child Welfare Funders. Therefore, we are proud and pleased to sponsor this Texas tour. You can see on the slide the purpose of Texas Child Welfare Funders peer group is to optimize the child welfare system from initial report to permanency, ensuring the best outcome for a child. We are a nonpartisan educational peer group for funders under the administrative umbrella of Philanthropy Southwest. Funders do not need to be members of PSW to join Texas Child Welfare Funders. This group grew out of other existing initiatives and is aiming for a statewide membership base as we grow. Currently, we have no dues and operate on voluntary donations from members. If you would like to know more, please visit the website on the slide. You can learn more about us, access resources, join our listserv, and view our contact information. Thank you again to TexProtects for this opportunity to help create a dialogue across the state about the child welfare system and how each of us can play an important role in supporting every layer of the system to ultimately benefit children. And now the TexProtects policy team will take us through the presentation.
Thank you so much, Adrienne, and thank you to all of you for being here with us today. We are so happy to see some familiar faces again that we connected with last year. My name is Brittany Taylor Ross, and I am the Prenatal to 3 Policy Manager here at TexProtects. And I am joined with the rest of our policy team. Jordan already introduced herself. I'm also joined with Emily Williams, who is our Mental Health Policy Fellow, and Carrie Judice, who is our Child Protection Policy Manager. Like I mentioned, we had the honor and privilege of going to 8 different communities last year and hearing from folks just like you all. And one of the themes that echoed really loud and clear from those meetings was that there is and continues to be an overall lack of support for children and families. We can't just do more of the same. And that we should continue to be investing more in keeping families together. So we took all of that information, we talked with lawmakers, we observed interim hearings at the Capitol to try to figure out what was most feasible and what would have the most impact leading into the 88th legislative session that is rapidly approaching and will be here this coming January. So all of that helped us to land on our official legislative agenda that we're excited to walk through with you all today. So for those who are not familiar with who we are, TexProtects is the only nonprofit, nonpartisan advocacy organization in Texas that is singularly focused on the prevention of child abuse and neglect. We are also the proud partner of the Texas chapter of Prevent Child Abuse America. So through education, research, and advocacy, we promote smart strategies all along the prevention spectrum, as you can see there on the slide, to hopefully prevent child abuse and neglect from happening at all, but also looking at strategies that will help keep families together and prevent removals that are really, for the best interest and safety of kids in the state's custody through CPS. So as I mentioned, we took what you all had said, over the past year and looked at what the data and research is showing us and telling us. And I think what you'll see here today is that the information really points us to why it is so necessary to better support children and families before a crisis occurs. So let's jump in and take a look at some of those data points. So as a state, how are we doing compared to the national average when it comes to caring for our children? I'm sure, as we all know, Texas likes to be the best and the number one at pretty much everything. But we aren't quite there yet on some of the metrics that you will see here on your screen. So according to the State of Babies report from 2022, there are some things that Texas is doing really well, and some things where we're just not quite meeting the mark when it comes to serving children and families in their communities. You can see from the slide here that Texas has more children who are uninsured, less families who are receiving benefits and supports overall, and an overall less resilience when it comes to families' circumstances. So what does that show us? We think that that shows us that families are in need of support, and we really need to be rising to the occasion as a state to help support families. So as you'll see here, this is another way that we know families are in need of support and aren't quite getting the support that they need at the right time. So we know that there are resource and referral networks like 211 and local ones like Laura mentioned with Help Me Grow, which are fantastic. But we still have families calling the abuse and neglect hotline because they just want to be connected to services in their community and they don't know who else to call. So we can see how steady this trend has been. Over the last decade, 4 out of 10 calls to the hotline are just because a family needs a referral somewhere in the community. So we also know that the Department of Family and Protective Services has recently launched their parent helpline, which we are really excited about.
And we're curious to see, you know, what this spotlight does to the trend that you're seeing here on your screen. And we hope that the result is more families getting connected to the resources that they need at the right time. And now I am going to pass it off to Carrie.
Thanks, Brittany. So yeah, to kind of pick up on this, we also know that more investigations are being closed out statewide without being referred to family-based services, or FBSS as you likely know them, which is that stage of service that is in place to provide families with supports and prevent removals. And so it would appear that this trend isn't necessarily the same for El Paso as it is statewide. You kind of see this line on your screen, but you know, as the number of referrals to FBSS seems to be kind of inconsistent at best for y'all's area, but we know statewide we've been seeing this downward trend. And regardless of where kind of you guys stand with, you know, the statewide trend, just because a family isn't referred to FBSS doesn't necessarily mean a family wouldn't benefit from services. And so, you know, if ongoing support isn't being provided through CPS, this means we really need to rely on communities to reach these families outside of CPS intervention. And so we also know, again, another trend here statewide is removals are down. Overall, we've seen removals drop about 40 to 50% over the last year and a half. Some areas have been impacted more than others, but the overall trend is a decrease in kids coming into care. For El Paso, again, it would seem like that isn't necessarily the trend here, but there does seem to be some fluctuation at least. And similar to what y'all heard me talk about with FBSS referrals being down, I would say that just because there's not that preponderance of the evidence to meet the burden of proof that's required by a court for removal, it doesn't mean families wouldn't benefit from supports. And there's a lot of speculation, as you guys probably know, as to why these numbers may be down. But the truth is that it's hard to pinpoint just one thing. You know, a lot has changed over the last year and a half or so. And so there've been a number of internal policy changes. For instance, CPS implemented what's called concurrent stages between investigations and FBSS, where they can jointly work a case as soon as they know the family's in need of those ongoing services and would benefit from those supports. And it, you know, again, it promotes that family preservation. But what we're hearing is that this is resulting in cases being closed out sooner, that internal policy. We also know that there's been some internal policy changes that require additional approvals for kids over age 12. And we know that last session, y'all heard us talk about this last year, about that change in neglect definition and the fact that there can no longer be non-emergency removals. Again, the intent behind all of these changes, whether internal at the agency or put in place by the legislature, the idea was for less kids to come into care. But for less kids to come into care, we would have hoped that that meant that families were met with the services they needed in the community to be successful. And so, but we're still kind of, you know, the verdict's out a little bit of whether that's been, all these changes have been more harmful or helpful to, you know, to families, and whether or not children are being left in those, you know, potentially unsafe situations. So all we know, you know, based on the information that I just shared, is that we know that families aren't receiving the services they need through CPS via FBSS or a removal. And so now I'm going to pass it over to Emily to talk a little bit more about what we're seeing about kids coming into care.
Thank you, Carrie. So for kids who do come into the state's custody, we have seen another issue rise to the surface, which is actually a product of a capacity issue, children without placement, or what you have often heard us referred to as CWAP. When the state cannot find a placement for a child who either just came into CPS care or disrupted out of their most recent placement for any number of different reasons, they are taken to an unregulated setting that is not fully able to meet their needs. And they are supervised by CPS staff or individuals they have hired to provide around-the-clock supervision. These are typically kids with higher needs. This pie chart on the right side of your screen gives you an idea of what kind of setting they were in before the state was unable to find them an appropriate placement to meet their needs. They may have just spent time in a psychiatric hospital where they were deemed a danger to themselves or others, maybe just returned from being on runaway status, but alarmingly, a good portion of these are youth whose parents have relinquished them to the state because they couldn't get them the mental health treatment they needed in the community. So again, another scenario where supports aren't available in the community to help keep these families together. And on top of all of this, Texas is still in the middle of a federal lawsuit that has been going on for over a decade that continues to show that the state's child protection system continues to place kids at an unreasonable risk of harm. The lawsuit has revealed things like overburdensome caseloads, leading to the agency agreeing to a goal of 14 to 17 kids per caseworker. It has also revealed things like kids being placed in settings with long histories of concerning deficiencies, leading to the needs for heightened monitoring with these placements and more enforcement in the regulatory process. It has also continued to shed a light on the fact that our state is in need of expanding our array of mental health services. These are just a few to name, but while the state has made progress in remedying some of these issues, we aren't where we need to be just yet. Therefore, Texas will continue to be under the scrutiny of this lawsuit until we can make sure that kids who come into custody aren't experiencing further trauma in its care.
Yeah, thanks, Emily. And so you guys have heard a lot of stuff going on. And so there's really, you know, a lot of issues in the system, meaning there's a lot of pressure on this system to do something different when it comes to foster care. And so one way that's being pursued is to move away from that one size fits all state approach to one that is led by each community. And the idea is that communities know their communities best and can adapt easier if needed. The restructuring that I'm talking about is community-based care, or CBC, because y'all know we love our acronyms. And it's more formally began in 2017 with the passing of what you all may have heard called Senate Bill 11. But it seems to be treated as the silver bullet for a fix to the current foster care system. So CBC, as you're seeing on your screen, it splits up the state into 16 regions, or what's called catchment areas. And the idea is to contract with local providers in those different areas of the state to be able to carry out those foster care services. And the areas in blue on your screen are the active areas, and the ones in green on your screen are the open procurements based on funding and approval from the last legislative session. And for those of you that have been around for a bit, you know that this has gone through quite the iteration. It used to have numbers and letters, but now we've got names for them. So hopefully you guys are keeping track. Another thing that had happened last session, the Office of Community-Based Care transition was created, and it's really a separate entity from the department to help with the rollout. And they have since changed the way providers can actually bid on contracts. So now providers who want to bid on an area can just come forward whenever they're ready and propose what areas they want to cover. So lots of changes happening. And as for what the department wants for this upcoming legislative session, we know they're requesting funding to expand into 4 new areas. And honestly, though, y'all, if it were up to the legislature, based on how conversations have been going at the Capitol, CBC would be implemented across the state much faster and likely in smaller chunks. So that's going to lead us into a little bit more specifically talking about what we have landed on with our legislative priorities. So again, all this information, that you guys graciously shared with us last year, the data points you just saw us kind of walk through that point us in the same direction, and what we know is going on in the system continues to show that we're in a perpetual state of crisis. And so we can confidently say that we know we need to be providing better supports for children and families all around. And that's really what our legislative priorities aim to do in several different ways. So I'm actually going to kick it over back over to Brittany, who's going to get a little bit more in detail about what we're doing.
Sure, thanks, Carrie. So as you'll see here, obviously our first legislative ask is going to be to increase funding for the Prevention and Early Intervention Division of DFPS, which helps to support prevention services for families and children across the state. Recently, DFPS released its legislative appropriations request, or as Carrie said, we love our acronyms, also known as an LAR. And that really is just a document asking the legislature for any increased funding above the base budget for priority items. So items that we know that in this instance, the department really wants to highlight for the next legislative session. There appears to be some renewed interest and attention on the importance of prevention services, such as home visiting and resource referral navigation type services to support families and young children within that legislative appropriations request. We were very happy to see that within that request, there is an exceptional item to expand prevention and community well-being services by requesting almost $86 million over the base budget to expand home visiting program by 50%, as well as a $2.3 million ask to support marketing and prevention campaign materials for the Texas Parent Helpline that PEI is starting to roll out that I mentioned earlier. I really want to highlight this because this is a substantial and historic increase in the prevention budget for the department and really points to this larger shift that we're really hoping will continue in the state around the support of prevention services. And as you can see here, on this slide, I think we shared a similar slide, I'm sure, when we were with you all last year, but currently prevention and early intervention services make up just 5% of the DFCS budget in comparison to spending on child protective services. So what this tells us is we really need to prioritize, again, meeting families where they are and offering support before a crisis occurs. And to do this, we of course must increase investment in supportive services to help families get access to the services they need at the right time. You can go to the next slide, Carrie. Thank you. So our next prevention-focused legislative priority is to scale and expand universal postpartum home visitation programs statewide. So first, I want to take just a moment to define what we mean by universal postpartum home visitation. It is quite the mouthful, as I am saying it several times. Maybe we'll work on coming up with a fun acronym. I don't know. We'll keep you posted on that. But short-term postpartum home visitation improves maternal and child health and well-being while also connecting families to the resources and supports that they need at a very vulnerable time right after delivery. Universal means that the program is offered to all families, regardless of income or any other eligibility criteria. And I also want to highlight that these programs are voluntary. And you can go to the next slide, Carrie. Thank you. So as you can see on this slide, 1 in every 10 children in the U.S. lives in Texas. And we know that this number is going to continue to grow as more and more families move to this state. I'm sure as we've seen, in Austin and communities across the state, the population in Texas, continues to grow. A lot of families are moving here. So coupling that, with the recent jobs decision, we're going to have more children in the state. So we really need to look at how are we supporting families as they welcome new children. Okay, so we know that there are a lot of children and families in Texas, but who actually has access to these prevention type services that we're talking about? As you can see here on this slide, there are 1.8 million families in Texas currently with children under the age of 6. Out of that 1.8 million, about 400,000 of these families may benefit from home visiting type services, just based on different risk levels, but less than 5% of families who could benefit from these services are currently receiving. And as you can see here, we wanted to point out specifically your community in El Paso. You can see this is for prevention and early intervention services that are rolled out through the DFCS PEI division. About 900 families in your community were served with prevention and early intervention services through PEI in 2021. So what do we know about prevention programs that are offered through the Prevention and Early Intervention Division? So we're going to look at a few outcomes here from 2 different home visitation programs that are funded through PEI, so Family Connect and Parents as Teachers. So Family Connect is a universal postpartum home visitation program, similar to what I just described a moment ago, in which a nurse comes to the home within the first 2 weeks after delivery, and just make sure that the family gets connected to any resources they might need, checks on mom, checks on baby. It's a very short-term intervention. And then, of course, as you can see here, we'll also talk a little bit about parents as teachers, which I'm sure you are all very familiar with, as they are amazing and have been around for a really long time. But as you can see under Family Connect, with this program, we see a 30% reduction in maternal postpartum depression or anxiety symptoms. We see 50% less infant emergency medical visits within the first 12 months of life. And we see 44% fewer CPS investigations at 2 years of age and 39% fewer CPS investigations at 5 years of age. And you'll see on the right side there with parents as teachers, we see a 22% decreased likelihood of child maltreatment, substantiations, and a 50% fewer cases of suspected abuse and neglect. So we know that these home visitation programs offer successful outcomes for families and work to protect children by connecting families to the resources and supports that they need. So our strategy this legislative session is to scale and expand universal postpartum home visitation programs statewide through legislation and a possible budget rider. We had a similar bill and budget rider, as I'm sure many of you remember us discussing last session, that was championed by Representative Donna Howard. That we are very thankful that bill seemed to have a lot of bipartisan support behind it, but it just didn't quite make it to the finish line. So we will be advocating for that bill again this legislative session. And just as a reminder, this piece of legislation would create a competitive grant program within the Department of Family and Protective Services, PEI division, that would be able to accept funds from multiple sources in order to distribute them to community providers for the expansion of these home visits for caregivers of infants. I am now going to turn it over to Emily to talk about our next prevention priority.
Thank you, Brittany. Okay, so we've spoke a lot about prevention with home visitation and other services, and now I'd like to speak on prevention just a bit more in regards to our ACEs priority. As most of you know, our aim with this bill is to make strides in improving the delivery of prevention services and increase the availability of these services so that all families and children from all backgrounds can access them in order to prevent ACEs from happening in the first place. And I realize I just used the acronym. ACEs stands for Adverse Childhood Experiences. So here on this next slide, we have a glimpse at the prevalence of ACEs in Texas. This is from the National Survey of Children's Health that is administered by the Federal Health Resources and Services Administration, as they typically offer the most comprehensive data available on the prevalence of ACEs in Texas. I will say, however, the survey is based on parent self-report, and it doesn't include questions about child abuse or neglect. So even these numbers likely underestimate the actual incidence of ACEs. I'll just touch on a few here, but the highest percentage comes from children that have experienced the divorce or separation of a parent, as approximately 1.8 million children have been impacted by divorce or separation, which is about 1/4 of children in Texas. 12.4% reported that they had difficulty paying for food and housing from their household income, which was reported as somewhat often. 9.8% of children in Texas live with someone who was mentally ill, suicidal, or severely depressed. 8.4 have lived with someone who had a problem with drugs or alcohol. And the last one I'll mention is 7.1 have had a parent or guardian that have served time in jail. So while this data is crucial to understanding the prevalence, I wanted to remind everyone that these numbers make up the hundreds of thousands of children's real life experiences. So on our next slide, We know that often adverse childhood experiences can also be traumatic experiences, and we also know that trauma can increase the likelihood of negative outcomes across the lifespan development. Trauma poses great risk to mothers and babies as it can increase health risks during pregnancy and cause preterm births and low birth weight. It can cause significant deficits in brain development, such as cognitive impairment, structural abnormalities, and toxic stress response system. It has been proven to increase the likelihood of one experiencing a chronic disease, such as diabetes, cancer, or STIs, and mental disorders such as depression, anxiety, bipolar disorder, eating disorders, suicide attempt or completion. In the school and work settings, we often see children being expelled from school, having a higher academic failure rate, and adults losing time at work to seek treatment. And lastly, we know that there is an increased rate of participating in risky behaviors, such as substance abuse, violence against others, and unsafe, risky sexual practices. So now let's look at some of the economic impacts of ACEs, some of the economic impact that ACEs can have. So TexProtects estimates that in 2019, Texas spent approximately $52.9 billion on the lifetime cost of confirmed child maltreatment cases. Some of the most staggering numbers come from the national health spending cost, which is at about $168 billion on illicit drug use, $160 billion annually for smoking, $73 billion annually on harmful alcohol consumption, and about $65 million annually on obesity. So the research shows that reducing trauma within families can lead to better financial outcomes later. Those who experience 4 or more ACEs across their lifespan are 1.6 times more likely to live in poverty as an adult than those who have not experienced ACEs. And in 2019, about 1.5 million children were living in poverty. So Texas ranks about 40 out of 50 states when it comes to the overall poverty rate. So all of the issues I've mentioned here today are reasons why we push the ACE bill. This bill will help us connect with stakeholders and communities across Texas to better identify what is working and what is not to really tackle the cause of childhood adversity. It will give state agencies back community guidance to better identify strategies to increase effectiveness of state prevention dollars. And then we can use these findings to propose recommendations to the next legislator so that we can continue to do what works, stop what doesn't, and make children and families strong. So that wraps up our ACEs priority, and I'll now pass it to Carrie.
All right, thanks, Emily. Yeah, so next up we have kinships. We're going to move a little away from prevention into some of our other categories. So with kinship, our ultimate goal is we want basically, make sure children are placed with relatives, make sure the caregivers have the supports that they need. And we actually have 2 strategies that we're pushing this session under this bucket of work. But first, I think it's important that we make sure we're on the same page about definitions. What do we mean when we say kinship or kin? We're talking about relatives or friends of the family who step in and care for a child when it's unsafe for them to remain in the home of their parents. And we know that relatives step in and care for kids in all kinds of scenarios. When kin steps in and provides care for a child in their home when CPS doesn't have custody, that's called an informal placement or informal kinship placement. And then there are kin that step in and care for a child when the state does have custody, and those are referred to as formal kinship placements. I've got some additional stuff on the screen, but those are kind of the highlights there. And so you heard me mention 2 strategies, right? So we have one that's focused on informal kinship placements and one that's focused on formal kinship placements. For those informal settings, what we have heard is there are 2 main barriers, financial and legal. You see those with the great icons on your screen, just in case you weren't sure. When the state doesn't have custody, there is really no assistance from the department. nor any legal standing for any informal kinship caregiver to make decisions on the child's behalf. And that's just something we continue to hear over and over. So to address this, we want to see a pilot program developed that would ensure the relatives are provided and connected to both legal and financial supports in order to prevent a removal. And we want to make sure that a case manager is assigned to the relative caregiver who can help get them the resources that they need. Ideally, a court would be involved as well, so that we can help make sure that some of those, that legal standing piece is addressed, to make sure that there's legal standing in place if the case is dismissed with the child remaining in the home of the relative and not the parent at that time. And then, you know, for those kids who do end up getting removed and placed in those formal kinship placements, these placements actually have an option to become licensed or not. You might also hear some language about you know, verification or not, kind of used interchangeably. For those who choose not to become licensed, we want to make sure those relatives are receiving pay parity in line with what foster parents receive for the duration of time a child is placed in their home. And we'll talk a little bit more about what we mean here. We know that the department prioritizes placing with kin. And as you can see on your screen, at least 43% of kids in CPS care were placed with kin across the different regions in Texas. But when we're looking into the numbers, there's really only a very small percentage of relatives who actually decide to get licensed. Just for some reference, like the number at the end of August of 2021 showed that only a little over 8% became licensed. And anecdotally, we've kind of heard a slew of reasons as to why this could be. It could be something in their criminal history from a long time ago. It could be family dynamics that are just, you know, kind of messy, and they don't want to become licensed and potentially feel like they're doing something against the parents, or even just not wanting to be under that much regulation. We've kind of heard different stories shared. And so, you know, that's kind of some of those reasons, but I do want to go in a little bit of some history here to talk about what supporting formal kinship placements has looked like over the years. I remember a time when kinship caregivers for kids in care weren't receiving any assistance, but you can see that over time, the legislature has done more and more to provide supports for kin. TexProtects was actually behind the movement back in the 85th legislative session back in 2017 that helped relatives receive more than just a stipend. Instead, they could receive up to half of what a licensed caregiver receives for up to 12 months. So it's basically what we see in statute now. And so just another one, when we're talking about supports and payments and things like that, I do want to put on y'all's radar that, again, you heard Brittany mention like the LAR from the department. We actually saw a $6 million ask. DFPS is asking for $6 million additionally. And part of that could be for $1,000 for kinship caregivers to meet like their immediate and concrete needs. Also could be offering reimbursement up to $750 if they want to become licensed. So we are glad to see that they have asked for additional dollars to be able to support kin. But we want to continue to move that needle even more forward. And really what we want to achieve is pay parity. So, you know, it's the way that the statute is written is currently limiting in a lot of different ways. And so we know we need to reopen that statute. So first of all, there's that 12-month limit. We want to ensure that relative caregivers receive compensation for the entire time the child is placed in their home. So we need to remove that 12-month limit. We also need to remove that 50% gap or cap on there, making sure that it's not capped at half of what a foster parent is receiving. And we also need to decouple it with the reimbursement rate, because there's some language in there about like the basic daily rate. And so because the current rate methodology system is kind of being reconsidered and redone, we know that we need to change the language in statute so that it's no longer connected to the current rate system for the future. And lastly, something that maybe folks on here have heard about, we've heard several stories about placements who haven't been approved maybe through the formal home study process, but were later approved by a court. Saying, you know, oh, we're going to approve this child to be placed in your home anyway. We have learned that a lot of times those particular relatives aren't getting the reimbursement they're not eligible for it. So we do want to make sure that regardless of who approves it, whether it's the department or a judge, if they are approved placement and that child is in the home, we want to make sure that they are eligible. And so, you know, honestly, we're thrilled because so many of our partners and us, there's just such a big push this session to better support kin just across the board. But I do just want to pause for a second and make sure that it's clear that we're not trying to disincentivize kinship caregivers from becoming licensed if they want to or able to. But we, like others, want to make sure that we're better supporting kin all along the spectrum. And that includes those that can't or may not want to become licensed. Now I'm going to jump into data. Again, I think you guys remember us talking about it last time. We're going to be pushing our data priority again this session. When we talk about the data priority, what we're talking about, again, is real-time data that is made available to the public to increase transparency, accountability, and effectiveness. It's important that we make sure that that critical child protection information is updated and published monthly, not annually, like has historically been the case with the department. And y'all heard me talk about this earlier. We have a system that's rapidly moving from that one-size-fits-all state approach to one that's community-driven. And so we need to know where changes are needed. We need to know what's going well and what isn't, so that the people doing the work and making decisions, like lawmakers, can do this in a way that's effective. So again, last session, you know, we were successful in some ways in getting that budget directive there. You know, we weren't able to actually get this into statute, but we were able to see that budget directive that would make sure that the department published monthly information, at least for the past 2 years. And if you haven't had a chance to check this out yet, you can see on your screen the different data that is now available monthly. I know I have used this pretty religiously. And so this little filter on the right side of your screen is something that each of the data sets, like when you click on them, you actually can, you know, pinpoint the month and the year that you want to look at. And so, you know, basically what happened last session, you know, the department could have just done this moving forward, but they actually also did this retrospectively. So we actually have access to a lot more information now. And so we want to see that continue ultimately. I didn't want to move on yet. And so, you know, the idea behind this is, you know, we ultimately just, because it's in a budget directive, we would have to keep coming back session after session to make sure that it's in there. And so the idea behind this is we do want to see it put into statute so that we don't have to keep asking for it each session. And that way we can show that we value having that real-time information moving forward. So now I will move on to workforce, which is our last priority before we get into those breakouts. So when we say workforce, we're talking about frontline workers at each stage of the department. So investigators, alternative response workers, FBSS workers, conservatorship workers. Our goal is to ensure we have high quality workers all the way up the career ladder, not just on the ground, but also in positions of leadership. And we really think this has to be tackled from several angles: recruitment, hiring, retention, and promotion. So let's first start by talking about like the recruitment, hiring, and retention piece. How do we get people interested in working for the state? And then once they get there, how do we get them to stay? You know, what you're seeing on your screen here is currently where we are with workforce turnover. I know you guys are hearing about it. You know, investigations, we see the turnover rate about 40%. Conservatorship, we see about 21%. And I'm sure you've all read in the news about that mass exodus of investigators since the beginning of the year. So we know it's an issue. And so when people in the community see and hear this, when we hear about the pressure the agency is under and all the negative stories in the news, what will attract workers to be here? What will attract the right people, the high quality people to work here? And so we know pay is a factor in getting workers to feel valued and ultimately want to stay. And you all may remember that TexProtects back in 2017, we were behind those pay raises. And we're glad to see that LAR also this time around, the department wants to see a 10% across the board salary increase for frontline workers. And so, glad to see that. We know that has to be a part of this equation, but we have to consider more than just pay. But it is a piece of the puzzle. So how do we promote a better culture and ensure workers are not overburdened? So let's say we figured out how to make workers stay. How then do we get them to want to promote? So we did a little digging into the pay and the difference in what a promotion will get you. So the state auditor's office actually said that pay is in line with other similar jobs in the market. So we know that that's the case, but we know that from talking, and again, those anecdotal stories, that people lose benefits as they move up the chain. For instance, we know in some positions like investigators, they lose their stipend if they promote. And the higher up in CPS that you go, you no longer can be paid for the overtime you put in. And you lose the ability to make some money off of your travel check, since management positions are obviously a little bit more desk bound. So those are definitely things to take into consideration when you're trying to decide if you want to move up the chain. Also, are you sure that it's actually being compensated adequately for the amount of responsibility that you take on the further you go up the chain? So obviously those benefits come into play, but what else needs to be addressed? We want to see high quality workers, not just any warm body fill positions all the way up the chain. And so as we're talking about workforce, think about it. We're talking about people that are making life-altering decisions for children and families. So we need to make sure we've got the right fit and the right seats, and that we've got good quality workers. So how can we do that? We actually know that the department has a human resources management plan, and it details how to retain workers, but we want them to update it and think through more than just retention. We want them to make recommendations and consider how to recruit, hire, retain, and promote that high quality workforce up the chain. And so having the department go through that exercise to figure out what is needed, that will honestly set us up well for even the next session to better know what to advocate for. So now we are going to, we've obviously laid out our priorities and kind of how we landed here and what's going on in the system. So now we're going to enter that time of discussion. And this is really where we want to hear from you all. You've heard us talk, we want to hear from you. And the way this is going to work is that we will have two separate groups. One that's going to be more upstream prevention focused, and another that's going to be more downstream system focused. You can see the topics are more broken out on your screen here. And so we really want you to choose which breakout discussion to go into. Because you guys know where you have the expertise, and we just want to hear from you. So you're going to have until 10:20 your time, and then we're going to bring you back into the main session to wrap up. And we will have TexProtects members in each of these discussions to kind of lead and guide you in those discussions. But we're really looking forward to the information you guys have to share with us. So I think you guys will be seeing something pop up on your screen. And just choose which one, and we'll see y'all in a second.
If you do not see the option to join a breakout room, please let me know and I can assign you. Alfonso and Jordan, what room would you like to join?
I'll go to prevention.
I'd like to be in prevention as well.
I think there's some transition happening. Hopefully everybody had a really great conversation. Honestly, I was really, I was getting really jazzed up in ours. I got to hear from a couple of folks, got some really great information. So Brittany and Emily, I'm sure you guys did too. So like I said, I don't know, do we have, I'm looking, where's Gloria on our team? Gloria, do we have everybody back? Or is
Yes.
it still, okay. I'm going to share my screen again. We're just going to kind of close this out now, you know, with just like next steps, that kind of stuff. But let me share my screen. Let's see. Okay, are y'all seeing a get involved thing going on? Okay. All right. So again, thank y'all. I know sometimes whenever you join these things, I know sometimes depending on how extroverted I'm feeling during that day, sometimes I'll be like, oh gosh, I'm going to have to really engage here. So I appreciate everybody sticking with us and participating in those conversations. It's really invaluable for us. Like I said, you guys heard like our coming talk to y'all last year really helped shape our priorities that we just came back to you with today. And I have no doubt that the information that were shared in both of these breakout discussions will be helpful for us moving forward into session. And so again, before our time is up, I know we got about like 8 minutes left. We want to provide you with some ways to stay updated with what we're doing, ways for you to get connected to our work. Y'all might have had some of those discussions in the breakouts, maybe not, but we want to make sure that you guys have this information moving forward. And obviously, you know, some ways for how you can help us get these priorities across the finish line this session. So pretty simply, if you're interested in staying up to date with what we're doing, any events we may be putting on, like we will have some other Texas tours in different areas. We've also got lunch and learns. We got a couple of those left before the end of the year. If you want to be notified basically when there's something going on that you can join, or during session, whenever we're asking for folks to push out advocacy alerts with your legislators, things like that, please go to our website and sign up for our email updates and advocacy alerts. When the slides are sent to you guys after this meeting, this is a clickable link where you can go to our website and you kind of see here, I put a little screenshot of what that part of our website looks like. Super simple, put in your information and email address. And so that way we know how to reach you and that way you can stay up to date. I'm also going to show you guys, if y'all participated last time, this should be something that looks pretty familiar. So if you're looking for ways you can more specifically get involved, we have several different ways you can get plugged in that you can see on your screen. You know, again, that first piece is, you know, just again, getting that input, you know, from what we're doing and knowing what we have going on. But there are obviously a lot of different ways during session that we may call on you guys to say, hey, are you willing to reach out to your legislator in your area? Are you willing to, you know, maybe retweet or, you know, post things on Facebook or share things that we're doing on Instagram so that we get the word out. And obviously, you know, just different ways that y'all can engage with the legislature. So again, this is just some different ways. We did a how to become like, or how to be a champion for Texas children last session that I think lives on our website somewhere that you can also check out. But these are some really great ways to kind of get involved here. Also, you guys know we love to resource you well. We want to make sure that you guys have access to these. These are also on our website, but here's an easier way to kind of click on some of these things. You see here we have a link to our State of the State report, which goes into much more detail than some of the slides that we showed you guys today. And it talks about, again, that child protection landscape here in Texas, but we have some different information in there. We also are linking our flowcharts as well as a CPS 101 that we actually teamed up with our sponsor on this event, which focuses on that removal to permanency and helps folks understand again at that high level what's going on with the system. So check that out. We also have some other resources like that home visiting advocacy toolkit, latest ACEs report, and our suggestions for transforming the CPS system. So check those out if you haven't already. And so we're going to go ahead and start closing this out officially. I may actually get you guys a couple minutes back to your day. We again want to extend our gratitude to our sponsor for the Texas tour, the Texas Child Welfare Funders. Adrian, I don't know if you're still on the call, but thanks for joining us today. And again, thankful that all of you took some time out of your busy schedules. We know that this is a very busy time of year. You know, thank you for taking time out. And again, huge thank you to Paso del Norte. Laura, I'm looking at you. You've always been a great partner to us. And so thank you for taking time to partner with us again. This is, like I said, some really invaluable information. This is excellent. And you guys always get the right people at the table for us. So lastly, here is our contact information for the policy team at TexProtects. You actually got to hear from all 4 of us today. So please don't hesitate to reach out if y'all have any questions, if there's something we brought up today that you'd like some more information on, or you're over there going like, I really want to get involved with you know, a particular strategy that we're working on, please reach out to us. We would love to continue that partnership with you all. But yeah, we're going to give you back a few minutes. We hope you have a wonderful rest of your day and rest of the week. And we look forward to continued partnership and you know, continued conversations with you all. So thanks again.